Studies like these showing that fruits can suppress the growth of cancer in a petri dish are all well and good, but we need to know if they can do the same thing within the human body. But it's considered unethical to withhold conventional cancer therapies like surgery, chemo, radiation to test out some fruit or vegetable. So what do? Well, one direction researchers have taken is to use combinatorial strategies. For example, adding phytonutrients from the spice turmeric or green tea along with chemotherapy to see if that works better than chemo alone. Well, this gets complicated because chemo and radiation often work by killing cancer cells with free radicals. And so antioxidants, though they may certainly reduce the toxicity of the treatment, there's a theoretical concern at least that it could reduce the efficacy of the treatment as well. Another way you can study the effects of plants on cancer is by testing dietary interventions on slow-growing cancers like prostate cancer, which is how Ornish and colleagues were able to show their apparent reversal in cancer growth with a plant-based diet. He could only get away with that because these patients were in an early watch-and-wait stage of cancer. Are there any other cancers like that? Esophageal cancer is not the cancer to get. 5-year survival is only about 13%, with most people dying within the first year of diagnosis. But the development of esophageal cancer is a multi-stage process, though. Right? You start out with a normal esophagus, the tube that connects your mouth to your stomach. It starts out fine. Then precancerous changes take place. And then localized cancer starts to grow. And then eventually it spreads. And then you die. But because of this well-defined stepwise progression of esophageal cancer, researchers jumped on it as a way to test the ability of berries, the healthiest fruits, to reverse the progression of cancer. A randomized phase 2 clinical trial of powdered strawberries in patients with precancerous lesions of the esophagus. 6 months of eating 1 or 2 ounces of freeze-dried strawberries. That's like over a pound of fresh strawberries a day. And the progression of disease was reversed in 80% of those in the high-dose strawberry treatment. At the beginning of the study, none had a normal esophagus. They either had mild or moderate precancerous disease. But by the end of the study, after all those strawberries, most lesions either regressed from moderate to mild or disappeared completely. Here's some representative before and after pictures. Give some strawberries, and many went from moderate disease to mild, or from mild to gone. By the end of the study, half of those in the high dose of strawberries walked away disease-free. A drop of tumor markers before and after. Some new chemo drug? No, all because of just strawberries. Showing for the first time that dietary strawberries could significantly decrease the grade of patients' precancerous esophageal lesions. Cellular proliferation before and after treatment with strawberries. Look at that, right? And what's the side effect? Like get a little strawberry seed stuck in your teeth or something? Recent population studies also suggest that plant foods are protective against esophageal cancer, whereas diets with lots of meat and fat appear to double the odds of cancer. And lots of fruits and vegetables may cut one's odds of esophageal cancer in half. A diet rich in foods of animal origin, poor in foods containing vitamins and fiber, in other words, plant foods, may increase esophageal cancer risk. And now we know at least one plant that may even reverse the course of disease if caught early enough. The findings were heralded as groundbreaking in an editorial in the Journal of the American Association for Cancer Research. Given that the editorial was written by a pair of pharmacy professors, though, they of course concluded that the active components and molecular targets responsible for the efficacy of strawberries must be identified, posing the question, is the best approach to just eat strawberries, or can they make a strawberry-derived drug that works even better? Remember this study in which garlic won out as the #1 anti-cancer vegetable? Well, let's see what it can do. This is what's called a COMET assay, currently the standard technique for the evaluation of DNA damage. What you're looking at is the DNA of a single cell, a normal human breast cell, as visualized under a fluorescence microscope. It's in an electric field trying to pull the negative charged DNA to the right, but our DNA is normally supercoiled tightly together. But you add a carcinogen, like in this case the cooked meat chemical FIP, that literally breaks up our DNA. You can see the chopped pieces of DNA breaking away and flowing out in kind of like the tail of a comet, which is why they call it the comet tail test. The larger the tail, the more DNA has been broken off into pieces. But if you repeat the experiment, and this time, what if you add the same amount of carcinogen, but also add in some garlic phytonutrients at the same time? You get some damage, some DNA breakage, but not as much as before. Which kind of garlic would be expected to work the best, garlic or elephant garlic, the so-called garlic for people who don't like garlic? And the answer appears to be garlic. Garlic is best. What about flavonoid phytonutrients found in fruits, vegetables, nuts, and grains? Here are the top 100 sources in the world. Do they have a protective effect on the meat mutagen-induced DNA damage? They took white blood cells from healthy individuals and colon cancer patients and exposed them to increasing doses of 2 cooked meat carcinogens, IQ, found mostly in fried bacon and baked fish, and FIP, found mostly in fried bacon, fish, and chicken. They used the COMET assay again, measuring how much DNA was broken off in the tail, and as you can see, as the concentration of meat mutagens increases, so does the DNA damage. They then continued to pump in that meat mutagen at the highest level, but started adding some plant phytonutrients. Quercetin, found in foods like apples, red onions, and berries, and rutin, found in like citrus, buckwheat, and asparagus. Even as the highest carcinogen dose continues, adding plant phytonutrients starts to bring the damage down. That happened in both healthy individuals, the solid line, and cancer patients, the dashed line. But I want you to notice something else. Even at a 0 concentration of cooked meat chemicals, there was more DNA damage present in the white blood cells circulating in cancer patients. And they didn't have blood cancer, they had colon cancer. Even though the cancer was just in their colon, their whole body was affected by the disease state. Their whole body was under increased oxidative stress, inflicting significantly higher DNA damage. Or maybe the DNA damage came first, and is one of the reasons they have cancer in the first place. Either way, cancer patients experienced less reduction of induced DNA damage, suggesting that higher concentrations of flavonoid would be required to achieve the same protective effect. So cancer and other chronic disease victims need even more fruits and vegetables to reduce the damage done by carcinogens.